while there was no escalation in this coaching protocol, the coach was able to better assist the patient in them making their own decisions about their care.
Welcome to the Coaching Revealed podcast. I'm one of your hosts, Austin Matzelle. In this episode of Coaching Revealed, I'm joined by Dr. Maria Benzo, an assistant professor of medicine and research associate at the Mayo Clinic, and professor of positive psychology at Life University. Her research explores how health coaching can empower individuals living with chronic illness. Dr. Benzo pursued coaching research after working in medicine, as she saw firsthand the impact coaching has on patients finding purpose and meaning. This led her to the concept of positive health, a framework that leverages biological, psychological, and social assets to help people move towards a state of flourishing. We explore findings from Dr. Benzo's research presented at the IOC's 2024 annual conference, a large-scale, randomized controlled trial involving patients with chronic obstructive pulmonary disease, or COPD. The study's results indicated that a 12-week health coaching intervention led to significant and sustained improvements in the patient's quality of life. This conversation also highlights key insights for coaches, including the critical role of value clarification. Dr. Benzo explains how her team developed concrete questions to help clients identify their core values, which become a powerful tool for sustainable motivation. If you are interested in learning about coaching research or submitting proposals for coaching research grants, please go to theinstituteofcoaching.org to learn more. And now, our conversation with Dr. Maria Benzo. All right, welcome to this episode of Coaching Revealed. Maria, it's so good to see you today.
So good to see you, Austin. I mean, we've been planning our conversation for a while. We're here finally.
So for everyone listening in today, our guest is Dr. Maria Benzo. But Dr. Maria Benzo is a physician and certified coach with a master's in positive psychology. She is an assistant professor of medicine and research associate at the Mayo Clinic and professor of positive psychology at Life University. Her research explores how health coaching can transform healthcare by improving both emotional and physical outcomes of medical patients. Dr. Benzo has coached patients across a wide range of complex medical conditions, including COPD, fibrotic lung disease, obesity, cancer, post-transplant recovery, and post-intensive care syndrome. Her work demonstrates how coaching grounded in evidence, self-determination, and human connection can lead to flourishing, even in the face of chronic illness. And so, Maria, we're so excited to have you here today on our podcast, specifically within this series, kind of looking at research within the coaching industry. It's also really special for us because as a coach and researcher, you've been able to be involved within the Institute of Coaching with some of our research having presented at our 2024 conference. But I would love to hear a little bit about what has, in your own words, what's your journey been like with coaching and within coaching research?
Yeah, well, it has been a journey for sure, as you presented there very kindly, right? I spent over a decade practicing actually medicine, and I was particularly in physical medicine and rehabilitation. And many times I felt that traditional medical care, it was essential, right? But it wasn't enough to help patients truly thrive and live a meaningful life. That realization really sparked a personal and a professional transformation within me. And that's where I realized that I would benefit from more. And I decided to transition into a research role at the Mayo Clinic, focusing specifically on health coaching. Coaching allowed me to shift from prescribing therapies to partnering up with patients and helping them reconnect with their purpose, their agency, and even in the face of illness. I was lucky enough to start my journey within the research realm because I feel that coaching is still very much an early stage industry, right? That requires that we have to gain the trust of the healthcare system and other systems. So we feel competent about being able to do a greater good with our clients. That has been my journey so far. I mean, it led me to getting trained as a coach, and it's been really a passion for me.
Yeah, and I can definitely hear, just the passion, but also warmth as you talk about this. There's so much excitement there. You're talking about how you are really interested in helping patients thrive. And so I'm wondering what drove you to want to research coaching impact on thriving or flourishing? Because you also mentioned there's pretty young field, so there's maybe a lot of areas you could have done research. How did you kind of arrive on your specific area?
I guess that while I was practicing medicine, I was trained in motivational interviewing. I guess it kind of fell on my lap to some extent that I realized that there are different ways we can communicate that can really impact care. Again, my biggest shift was understanding that medicine is great at stabilizing patients, curing when possible. But really, that journey from 0 to 10 was missing for me. That journey from surviving to thriving to really flourishing. That's where I started training in positive health, and this concept introduced by Dr. Martin Seligman really resonated with me. Positive health is beyond the absence of disease. It's about how can we leverage these assets that can be biological, psychological, or social in order to activate individuals to really fully live a meaningful life. That's where coaching comes in. I mean, at least in my perspective, right? As a provider, as a physician, you have so much on your plate already. And I believe that coaching can be that middle ground, that supporting professional that can work on the positive health side of things from, again, the 0 to 10. I love that. It really resonated with me when I was introduced to this concept.
I really love that idea of, yeah, getting people from 0 to 10. And so I'm curious also in that earlier work that you did, do you have any initial clients that you worked with or patients that you saw the impact of coaching as you were focusing on flourishing and not just surviving, but thriving?
Absolutely. So, as always, you kind of learn along the way. And I started my biggest patient population has been with chronic pulmonary patients. And I started to notice that patients that came with a more optimistic mindset were doing so much better than my other patients that perhaps were in the very pessimistic mode. That was kind of my first hunch to there's something here. There's something here that we can work on. And I was able to go back and kind of review the literature and it was already there, thankfully. Training optimism as a mindset skill was really a positive factor that allowed patients to manage better, to have more life satisfaction. So those are the things that I started to intentionally work on with my coaching client. Can we change our perspective? Can we cultivate seeing the good? Can we appreciate what's working for us? That doesn't mean that we're not addressing their suffering at all. We're taking it all into account, right? We're just giving space to both. Perhaps the suffering that is something that we can't avoid as human beings, but also let's take time to appreciate and cultivate this positive mindset that will help us move forward. And that was my initial insight into positive psychology and coaching and how they kind of overlap.
That makes so much sense. And so before we get fully, into deeper into your research, because we're looking at what people are doing for their life satisfaction and optimism, just for people to get to know you a little bit better, what are some things that you find you need for your own flourishing?
Well, I'll be honest, this was very intentional work because once you come into this world of coaching and positive psychology, you realize that you can't talk the talk, you got to walk the walk. And I was able to, just work with myself until I articulated my personal philosophy, and that grounds me in my own flourishing. And it's a three-part answer. So it's being present, being grounded, really trying to be in the here, in the now. That's a very important part of my flourishing. Secondly, staying connected. I am I'm nothing if I'm not connected to myself and the people that I care about. And that fuels me. I mean, I just happen to know this about myself. Connection fuels me. And last but not least, I intentionally cultivate joy. I know what my happiness boosters are. I know what gets me into that joyful sensation, joyful mood. And, it's outdoors, it's yoga, it's salsa dancing, it's chatting with a friend. And those things just, I'm very intentional about that. And again, I think that we need to walk the walk. Otherwise, when we're coaching or when we're doing anything in life, right? If we're not coming from our own experience, it's not authentic.
I've also done a good amount of social Latin dances, so salsa and bachata. I mainly do bachata, but they're so fun, and there's something like a buzz and energy in a room of people who are all engaged in that activity, and that touches on both staying connected and being present and joy, like all three of those things you were talking about. I would love to just get into a little bit, what was the research that you were doing on pulmonary disease wellness and the health coaching intervention? For anyone who is listening, Maria was part of the IOC's poster presentation back in our 2024 conference, and you were also a winner with your poster. So we're super excited to have you back and get to kind of talk through a little bit more of all of this research beyond what was there at the live presentation.
Yeah, absolutely. So let me give you a bit of context here. At the Mindful Breathing Lab at the Mayo Clinic, we conducted a large randomized controlled trial across multiple sites to see if the combination of health coaching with a home-based physical activity program would improve the quality of life of people with chronic obstructive pulmonary disease. Now, we enrolled 375 patients in the study. We randomized them to either a 12-week health coaching intervention or a control group. The intervention included weekly health coaching calls grounded in motivational interviewing and mindfulness, along with a home-based system that tracked daily steps, symptom management, and the patient's engagement with the video-guided exercises. So the coaching really was designed to support behavioral change, self-management, and well-being. Of course, we took measures before and after this intervention, and the results showed significant improvement in physical and emotional quality of life. It also showed specific improvements in dyspnea, which means shortness of breath, which is something very prevalent in chronic pulmonary patients, improvements in fatigue, in emotional resilience, and a sense of mastery in their lives. And we also saw, as a kind of a secondary outcome, we saw improvements in self-management, in depression scores, in sleep quality, and in daily steps. And these benefits were sustained 12 weeks after the intervention. So that was a very important part of our results, because when they discontinued the health coaching, they were sustaining their behaviors. So these were very positive results. Patients who were coached felt better physically and emotionally. They walked more, they slept better, and they felt more in control of their health, right? So this showed that it's a powerful way to support patients, right, who perhaps can't access other more traditional programs. This was completely remote. So yeah, we were excited about those results.
Yeah, the advent of all the remote technology that we have is absolutely fascinating in the way that we're able to provide care across the world, or the fact that we're even having this Zoom call. There's so much power to the fact that we're able to communicate while we're so far apart. For the patients themselves, can we get a little bit more information about them? What like their ages are, what is the impact of COPD on an individual, and what's kind of at stake here when we're looking at improving their quality of life?
Yeah, absolutely. So, to give you kind of a bit of context on our patient population, chronic obstructive pulmonary disease, I'll just say COPD from now on, affects not only breathing, but also energy levels, emotional well being, it affects their sleep and their ability to engage with daily activities. So when it comes to quality of life decline, we see that it correlates with increased hospitalizations, increased healthcare usage, and reduced life expectancy even. So when their quality of life declines, there's a lot at stake. And especially, we're talking about human beings, and what's also at stake is the ability to live with dignity, to be autonomous, to have a purpose in life, even in the face of a chronic illness. Many of our patients feel isolated or discouraged, especially when traditional medical treatment only focuses on symptom management, right? And there's so much more to their life than just managing their symptoms. By improving quality of life, we're not just reducing symptoms, we're helping people reconnect to their meaningful lives. That is why health coaching is so valuable, right? They address the human side of living with a chronic condition, and they offer a pathway to hope and empowerment. So I guess that would be why at least we feel health coaching can be so supportive in this moment.
That really relates to my love of coaching personally. I think it's just getting to see the impact of not just trying to prescribe someone what they should be doing, but helping guide them towards making those decisions themselves from a place of intrinsic motivation or from a place of autonomy, as you mentioned, so that the lifestyle change doesn't feel forced. The lifestyle change is one that's sustainable, which also you've mentioned we see in the study being 12 weeks after the study end, they're still impacted positively. You mentioned that the coaching intervention involved a level of mindfulness. I'm curious what specific coach training or what specific intervention were the coaches doing during the intervention period of this study?
Ready to advance your coaching practice? Join the Institute of Coaching and tap into the world's leading resource for coaching science and professional development. With over 4,000 members across 130 countries, the IOC offers invaluable networking opportunities with an elite global coaching community and innovative learning to broaden your knowledge and keep you at the forefront of coaching best practices. Engage in cutting-edge learning events with world-renowned coaching scholars, from webinars and seminars to discussion groups, research projects, and more. Try any membership free for 30 days. Use promo code IOC Podcast and visit instituteofcoaching.org/join to get started.
Yeah, so this is a sensitive topic for many because our coaches were not accredited. We trained our coaches and they were coming from different backgrounds. They underwent specialized training rooted in motivational interviewing and mindfulness. Those were our two pillars. There was an intentional preparation, right? So beyond the technical skills, we did emphasize the importance of having a mindful presence as a coach, to be empathetic, to train this deep listening, and also practice the meaningful silence, right? That was very much part of the mindfulness training. So they also needed to work on their own mindful presence and ability to listen deeply. We also really emphasize the concept of not fixing problems. A coach is not there to fix their patient or to fix their client, but to create this receptive space where patients could explore what mattered most to them. The coach training, it took about 6 to 8 weeks, depending on when coaches were onboarded. Beyond that 6 to 8 weeks, we did weekly fidelity meetings. And the reason for this is to ensure consistency and quality across the intervention. And this is something that perhaps is more common within research, but not common in the clinical setting, right? So what we were doing in the weekly fidelity meetings is we were reviewing coaching calls. We were able to reinforce best practices and maintain alignment with the coaching model that we had designed. Beyond that, I think research, again, is a space of luxury in the sense, right? Because we had weekly coaching rounds with the principal investigator, a pulmonologist, which provided essential information for the coach to feel confident in their role. So, for example, in the coaching rounds, there was a space for the coach to ask disease-specific questions that emerged in the coaching sessions. Rather than the coach stepping out of their scope, they were able to at least gain clarity and context about what was going on with the patient. And this structure allowed them to better understand what the patient was going through while staying grounded in their role. And it created a bridge between, the clinical insight and having a coaching presence, right? So while there was no escalation in this coaching protocol, the coach was able to better assist the patient in them making their own decisions about their care. So the coach stayed within their role. They had better understanding of what the patient was going through and supported the decision making of the patient in a more effective manner.
And so within this dynamic, you're giving these coaches training on mindfulness and motivational interviewing leading up to the intervention. What types of questions and what type of growth did you see within the coaches during the intervention time period? What were they learning working with this population?
What we saw is that initially coaches have confidence in what they know. So as they were presented with different patient contexts, they really had to step outside of their comfort zone and learn more about their patients. And that required them to really listen deeply to the patient, right? Because the patient is so much more than wanting to exercise a bit more because their doctor told them so. What grew in their skill development, and I would say in myself, is the ability to listen more deeply, the ability to reflect back and check for understanding, the ability to detect or clarify what are the patient's core values. Where do we need to go? Where do we need to connect the dots? Value clarification has been a skill set that we kind of incorporated as we started to see that it was such an important way to motivate our patients. If we knew what they stand for and what matters to them, and we can connect the dots to the lifestyle that they want to, cultivate, that was, if you will, the lottery ticket for us. And we started creating these coaching toolboxes. So we had these kind of special questions that we would bring up that would really get us to that value clarification.
That term, value clarification, what are some of those tools that emerged that were helpful for your coaches and for this program and helping get at what a client's values were?
Well, for example, one of our questions is, why does it matter that we spend this time, talking about this behavior that you want to cultivate, right? Why does it matter, right? But at the end of the day, what is it that drives you intrinsically that you cannot live without? So these are different types of questions because when you ask, not everybody resonates with what's your meaning and purpose. That language is it's almost like an alien language to some people. So we really need to break it down and ask, okay, tell me a little bit about you. What matters to you? And then from the deep listening will come, the coach can kind of strength spot or kind of see where the values are. And again, for every person is different. So we started like writing down those questions. What matters most to you? At the end of the day, why does this matter? How is this important?
And that's so real too. You can't just ask every single person you meet within a coaching dynamic, what is your ideal self, or what's your purpose in life, to figure out their values. This, I think, leads really well into some of maybe the challenges in developing this study, because this is one of those successes that you found within working within this population. You said it's over 300 patients were involved within this initial study. So what are some of the challenges in doing a study at this scale?
We had two bigger challenges. This study started about 6 months before the pandemic. We had to really adapt to what was happening in the world. And thankfully, we already had a remote program, but we were all working from the clinic, right? So when the pandemic hit, we actually saw a surge in patient enrollment because since nobody could go get care in person, we started getting so many referrals. We didn't even know how to operate. We were overwhelmed. And that meant that we had to quickly adapt our operations. So basically, all of our coaching personnel transitioned into remote work. We all became Zoom masters. All of our coaching meetings, fidelity meetings, everything transitioned into Zoom. Our tech team was the one that took turns to go into the clinic to be able to safely deliver these home-based monitoring systems to our patients. But everything really changed because all of a sudden we didn't see anyone anymore. Consenting patients was over the phone, explaining to them, how the system worked. Everything was over the phone. It made us a resilient team, if anything, because we had to be on our feet, really resolving in a moment where, in comparison to other teams, we were overwhelmed with work. I mean, we had so much referral. We had to adapt to the pandemic and adapt to the surge. That was our biggest anecdote, and we were happy to get through it. And the second one is that many times patients are referred to programs like this with no knowledge of what health coaching is. So they come to they pick up the phone, or they join the session not knowing what health coaching is all about. So there is a little bit of an educational piece until both parties are in agreement of what we're going to do in this time that we have together. Because patients coming from healthcare are used to being told what to do. And coaching is partnering with your patient to work on whatever matters to them in the pace that suits them. So it's a very different dynamic. And we also saw the need to, make sure that we were educating about what health coaching is so we could really make, a difference and a shift from prescribing to partnering.
Yeah, that's especially with a population that isn't familiar with coaching and it's kind of being placed into it within the medical field. Just as you said, not being used to such a non-prescriptive approach. Was this pretty high stakes in terms of you bringing patients in, they're having a meeting about what this process looks like? Was it there was one conversation to feel out if they were willing to do this? High stakes might not be the right word for this, but was there a small window to kind of get the patient to buy into the process?
Well, yes, because we usually, the week 1 and week 2 of the intervention, we gave leeway to a lot of information giving because we realized that it was necessary for both parties to get on board on the same boat. Now, to be completely honest, some patients were very much in the pre-contemplation about coaching. They weren't too sure about if they wanted to fully kind of surrender themselves to the space, right? To give themselves to that space. That took a lot of meeting people where they were. And that is exactly what our motto was. If we found that certain patients perhaps weren't comfortable with the coaching setting, we would just have a conversation that was, of course, in the background had coaching intentions, but less structured, so the patient would feel comfortable about just having a conversation. And it gives me kind of a bridge to talk about the coach relationship. That is, we had over 90% alliance in our working alliance. So the working alliance inventory is a questionnaire that, in this case, the patients filled out after the coaching intervention. And it asks the patients, how do they feel about the bond between the coach and the patient? How do they feel about the agreement on what task they were working on and what goals they were setting? And again, with a 90% of a working alliance, I think we really worked on this coaching therapeutic alliance a lot, especially in patients that perhaps were a little bit on the pre-contemplation side about being coached, So that's how we at least framed it in meeting people where they were.
I'll shift us over a little bit. We've been talking about some things that relate to another area of your research, which is self-determination theory. We've talked a lot about the autonomy and the relatedness portions. So I'm really interested here, within the research that you've done, how does self-determination theory guide effective coaching approaches for clients, specifically as a model to manage chronic illness and health challenges?
Well, this came from a sub-analysis from this database. What we wanted to know really is, does the self-determination theory, which I'll speak a little bit about, support the type of coaching that we do, right? Because when we designed our coaching intervention, we said, okay, motivational interviewing and mindfulness will be our kind of baseline training. And then at the end, we really wanted to know if this particular theory was supporting us. So what the self-determination theory speaks to is that there are 3 psychological needs that need to be satisfied in order to be intrinsically motivated to do whatever we want to do for behavior change. Coaching, we found results that yes, the self-determination theory does support our work. Coaching fosters these elements, and for example, incompetence, right? Helping clients feel confident in their ability to manage challenge. A coach can definitely do that, right? There are specific techniques where a coach will work on the self-efficacy of a certain task. The coach will help with the progressional goal setting. The coach will reflect back on the progress made so far and help the client plan the next steps for the future. So competence is definitely something within the coaching realm that is addressed and cultivated. Supporting a sense of ownership about what they're working on. Well, coaching is a client-centered approach, right? If anything, we're here for the client. We're here to work on what matters to the client, not specifically what the coach has on their agenda, but what the client really has intention to work on. So emphasizing this autonomy is also within the coaching skills. And then the relatedness speaks to, do I have a sense of belonging? Do I feel supported by other people? Right? So we talked about the coaching engagement as a relationship, right? So the coach has a relationship with the client that fosters, that cultivates this motivation and behavior change. But even beyond that, the coach can address, what is the social support network that the client has, right? And is there something to gain awareness on? Is there something the client wants to further develop in that sense? Because once the coaching journey ends, they need to continue to have that support and sense of belonging. So that's why I believe that the self-determination theory, if a coach works with that intentionally, they will create more resources for the client to live a meaningful life in spite of a chronic disease and beyond the coaching engagement.
The resource portion, I think, is so valuable because, yeah, we talked about earlier, these are clients who are facing at times a decent sized list of health conditions that are impacting their quality of life, potentially in negative ways. And so, what it really sounds like is you're looking at the models and the ways that coaches can be that really are client focused and client centered, and emphasizing the ability for the client to start leading their own treatment management in specific areas so that they're able to improve their own quality of life and do it in a way where not everyone, can have a coach all the time. So doing it in a way where it's sustainable beyond an intervention, I think is so fascinating because now they can maybe find ways to get aspects of those things they found in coaching in other areas of their life. With talking about self-determination theory as one of the specific tools or the specific theories that impacted the research, were there other theories or frameworks that you have looked at or you find to be essential in working with client populations that are experiencing suffering or comorbidities?
Yes. So, like you mentioned, these are complex patients. It's not just a pulmonary disease, it's so many things going on for them. I'm very determined at least in my role as a researcher, as a coach, that we have tools that give us as coaches the competence to be effective and to feel that we're doing good. So what I'm very enthusiastic about is deepening our coaching approach and incorporating more advanced cognitive behavioral frameworks because to be honest, the self-determination theory, it's been here for a while. It's a very basic framework and it's great. Now, I think we can do more. From the basis, we can deepen more. And so again, right, our prior work demonstrated that coaching grounded in motivational interviewing, self-determination theory, enhanced patient outcomes. Building on this, I see great potential in acceptance and commitment therapy. And I'll refer this to ACT, A-C-T. So ACT is a framework that emphasizes psychological flexibility, which is the ability to stay present, adapt to changing circumstances, like in complex patients, take action guided by personal values, even in the face of difficult thoughts and feelings, which is something that we all have. Difficult thoughts and feelings, right? So I think that this aligns very closely with health coaching, and ACT, while it's already an evidence-based intervention, it's used across a variety of different clinical settings. I think it has a lot of value in coaching because it has a lot of versatility as a transdiagnostical approach. What does this mean? It is helpful to cultivate psychological flexibility beyond any diagnosis that you might have. Even if you are a healthy, and we'll say healthy, I don't have an illness, I would benefit from cultivating psychological flexibility in my life. This is why I believe that an ACT-based coaching program, right, can be very beneficial in our complex patients. We have just started to use it in our protocol. So we're like in our baby steps. So we just defined which are the main components that we will incorporate to our already ongoing coach program. And we're optimistic about it. I mean, we've tried an ACT-based program in coaching physicians. And while it was a pilot program, we had great results. So now we're kind of bringing it into our complex patients and seeing what happens.
You're perfectly leading into my next question, and I also definitely agree. I think we all would benefit. I know I definitely would benefit from more psychological flexibility. So I'm going to be taking those words with me from today's conversation also. But what are some of the areas of research that you're looking into? What's next for you?
I have two main areas that I'm passionate about right now. I mean, one is using ACT in our health coaching, right? That is something that I believe will be very powerful and transformative as, again, just as a model of human suffering and flourishing at the same time. So I think it's a very integrative model for coaching. And secondly, I want to explore how can we consistently deliver high quality coaching outside of the research settings. Because in clinical trials, we benefit from the funding, the structure, the training, the fidelity checks. But in real world practice, this level of quality is challenging because coaches many times are there on their own with little or none team support, right, to kind of have their back and hold them accountable to high quality coaching. So to address this, we have been developing at the Mindful Breathing Lab an AI, so artificial intelligence assisted health coaching fidelity tool in collaboration with Ovida AI. This tool uses a natural language processing to analyze coaching sessions and provide feedback on the adherence to these evidence-based techniques like motivational interviewing. It doesn't require a human assessor to be reviewing every session because we're training the AI model to do that. And this approach will allow us to maintain high quality coaching at scale, right? When the clinical supervision is not really feasible.
That scale specifically you're talking about, yeah, you'd be working with hundreds or thousands of coaches to help see how closely are they adhering to different models. Are there other things that you think coaches can be doing to learn from this research that you've done in making their coaching interactions effective in dealing with patients in a healthcare setting?
Of course, I can speak from my research background and my coaching experience, right? I believe that we as coaches, we have a responsibility to make coaching credible and trusted. And for that, we do need to be updated on what are evidence-based practices that support our work. I guess my suggestion to myself and to any coach out there is know what is supporting your work. What are your frameworks? Do you know what you're doing when you are doing it with your clients, right? So when I teach coaching, I always say, like, there's this little triangle, and on each vertex is one is, how am I showing up as a coach, right? What is my coaching presence? Do I work enough with myself so I can show up in a coaching space ready to work? Am I able to deeply listen to my client and understand them and their context? And in if you will, in the upper vertex is what coaching process or what coaching framework is supporting my work right now. So that strays away from having a one size fits all roadmap, right? When we are very new to coaches, we kind of need to know, like, what am I going to ask next, and how would I lead into the other section of my session? And right, we kind of need this structured roadmap in the beginning because we don't know our way around. But as we become more competent and more mature in our coaching practice, we need to know what are evidence-based practices that support our work. And secondly, we need to trust that if we cultivate our coaching relationship with our client, this will go a long way. And, it's not just my research, there's a lot of other research out there that says this. You go a long way in supporting this relationship because that trust that is created in that space will motivate your patient or client and will take them a lot further.
It's a long way, and it's also a really, really important journey that both the coach can go on and also the coach and client kind of can go on together. We do have to wrap up, unfortunately. So for anyone who's listening in, we will be having Maria on for a webinar with the Institute of Coaching a little bit later this year in 2025. But Maria, how would people be able to follow along with the work that you're doing or hear about this really important research that you're involved in?
Well, I mean, I am on LinkedIn. I guess that is a very easy platform to find me. I will continue to collaborate with the Institute of Coaching, which is very much feels like home. So, those are two great ways to contact me.
Amazing. Well, thank you so much, Maria. It's so great talking to you today. And to everyone listening, thank you so much for tuning into Coaching Revealed, and we will see you next time.
Thank you so much, Austin. This was wonderful. I had fun, and I hope we do this again.
Of course, me too. We'll be back for round 2 with the next study.
Thank you for listening to this episode of Coaching Revealed, brought to you by the Institute of Coaching. You can learn more about the Institute on our website at instituteofcoaching.org. You can stay up to date with new episodes of our podcast by liking and following Coaching Revealed. You can also find us on social media on LinkedIn, Instagram, and X with the handle Institute of Coaching. We also love hearing from our guests, so please reach out to us with thoughts you have on this episode and any questions you have about coaching. Until next time, this is Emily Tarani with Coaching Revealed.